Hi guys, firstly we hope you're all keeping safe during these difficult times. Here at Cedarwood we're really missing the clients and each other and of course the pets. So as a way to stay in touch with you all, we're going to start a sort of online series of short informative videos over the coming weeks. It's not a substitute for seeing you all of course, but it is the next best thing and sort of all we've got to work with at the moment. Now these videos are going to go on our Facebook page, on the YouTube page, so please do comment with any topics you'd be interested in learning about and we will do our best to put some videos together for you on these topics over the coming weeks. So today, as a starting point in the first of our Cedarwood classroom sessions, we are going to discuss dog vaccinations. At Cedarwood Vets we recommend that all dogs of all ages are vaccinated against a few important diseases, namely parvovirus, distemper, hepatitis and leptospirosis. Generally, there are two groups that vaccines of dogs sort of fall into. Those that protect against severe life-threatening diseases and those vaccines that may be considered necessary if there is a particular risk to a particular patient, so more on an individual basis. The life-threatening diseases that we aim to cover for with vaccination in dogs are distemper virus. This is a really nasty neurologic or often respiratory tract virus. Canine adenovirus, which causes canine hepatitis, a serious, often fatal liver disease of dogs. Canine parvovirus, which is usually the one that people have heard about. This is the one that often causes severe bloody diarrhea, often in young puppies. And leptospirosis. This is a bacterial infection which can lead to kidney failure and death of dogs. It is extremely important to recognise that leptospirosis is what we call a zoonosis. So this means that humans can also get this disease and lead to severe disease. The second group of these vaccines is the risk-assessed individual sort of case-by-case ones. The main one in this group is the kennel cough vaccination. Works a little bit like the flu vaccine in people. The other one in this group is the rabies vaccination, which of course is only required for overseas travels. We don't have rabies in the UK. So what vaccination and when? There's been a lot of media attention sort of recently over the last few years regarding vaccinations, and it has led to you guys as owners to worry about over-vaccination of their dogs and risk of vaccination and vaccine reactions. Please do just speak to your vet or the nurse if you do have any concerns. We are more than happy to discuss with you why we recommend which vaccinations for your dog, when and why. But in a nutshell, under normal circumstances, where a puppy has received its primary course, so between 8 and 16 weeks of age, and its first annual booster, so the one a year later, they then only require boosters for parvovirus, distemper and hepatitis every 3 years. But the kennel cough vaccine and the leptospirosis vaccine, so the nasty one that people can get, do not provide such long-lasting immunity, and these do need to be repeated every year, okay? Another concern that owners often say is they're worried about vaccine reactions. But please do be comforted by the fact vaccine reactions are extremely rare. Of course they do happen. Nothing can be zero risk. But as a professional group of people, we would not recommend something that is dangerous to your pets. We all vaccinate our own dogs. We wouldn't do so to your pets, our pets, if it was too risky. Vaccine reaction, as a phrase, sounds quite scary. But generally, they are very mild, just a bit of swelling or itching at the injection site. None of these horror stories you read about. As a vets, we do believe that the risk of contracting any of these diseases by far outweighs the risk of giving a vaccine. Okay, so I hope this has helped to explain a little bit about dog vaccines. I hope you enjoyed the first Cedarwood classroom. Stay safe and tune in next week. Take care. Bye.